Hey everyone, if you're dealing with joint pain or inflammation, chances are you've heard of cortisone shots. Maybe you've even had one. They're a common go-to for relieving pain fast, but are they really as helpful as they seem? Today we're going to be talking about the hard truth behind cortisone shots and some of the hidden risks you should know about before deciding if this was the right option for you. I'm Dr. John Schaefer. I'm a physical therapist, strength and conditioning coach, and board certified in orthopedics. I specialize in helping individuals overcome their knee pain, both in person and virtually through my online programming. And I want to help you take control of your knee health so you can make informed decisions that are best for you right now and where you're at in your journey. So let's break it down. Cortisone shots or corticosteroid injections are a powerful anti-inflammatory treatment. They work by reducing inflammation directly at the painful site. In this case, or in our case, typically most of my audience has knee pain, the knee. So for many people, this means rapid relief, and this can be something that's initially pretty exciting to think, okay, I just need this injection and things are going to get better. Sign me up. But here's the thing, while cortisone shots can help reduce pain temporarily, it doesn't treat the underlying cause of your pain. And in some cases, it may even come with risks that might make you think twice regarding whether or not this is something you even want to go through with in the first place. So, cortisone shots are most commonly used for conditions like arthritis, tendonitis, or bursitis, anywhere that inflammation can occur and is causing pain. Now, they can be effective for temporary relief, especially if you've got, say, an important event coming up or just need to get through a rough patch. But here's the catch. Cortisone does not heal anything. It just reduces inflammation for a little while. So once that effect wears off, the pain can come right back, which can sometimes lead people to getting repeated injections. And that's where we start to run into more issues too. If you're getting, several injections a year, then that starts to raise, some red flags and concerns. So let's talk about the risks because cortisone is not without its downsides. There are a few key risk factors you should be aware of if you're considering cortisone injections in the first place. The first is tissue damage. So, cortisone can weaken the tissues in your body. Repeated cortisone shots, especially in tendons, can actually weaken those tendons over time. And that's why doctors are usually hesitant to give more than a few shots in the same area per year. And I always will tell my patients, really think twice if you're getting into, two, three, four injections a year. Many doctors won't even offer that just because of the risks associated. Another big risk factor is bone loss, especially in people who have those repeated cortisone injections in weight-bearing joints like the knees or the hips. So some studies even suggest that cortisone can lead to cartilage loss, which means you could actually end up with worse joint health in the long run. So initially seeking out this treatment that's going to help you could actually harm you in the long term. Also, with any injection, there is a risk of infection, but it's particularly important with cortisone because it suppresses the immune response. So that's why it's crucial to go to a licensed professional for the shot, someone who knows how to keep everything sterile. We're seeing more and more. There's a lot of medicine that's going on, both in the United States and in other areas where it might not be fully sanctioned. So just make sure it's, with a trusted professional if you are getting these injections. Another risk is elevated blood sugar. So cortisone can also spike blood sugar, which is especially concerning for people with diabetes. For some, blood sugar levels can stay elevated for days after an injection. So if you have diabetes or blood sugar concerns, make sure that you're consulting with your doctor and that they're aware so that they can help you manage it. Next, we have skin and fat atrophy. So another common side effect is something called skin and fat atrophy, which basically just means the tissue around the injection site can thin out, leaving noticeable dimple or changes in skin color. This might not sound like a big deal, but if it's permanent change that some people are bothered by, especially if the shot's in a visible area. And then lastly, adrenal suppression. So this is a lesser known risk, but if you're getting frequent cortisone shots, your body's natural production of cortisol, which is essential hormone that's basically a stress response, can actually be suppressed. And this can lead to adrenal suppression, which makes it harder for your body to respond to stress, which makes sense. So when do cortisone shots make sense and when don't they? Because now we know, some of the benefits. We know that there's several risks. So how do we weigh in when to get these shots, how often to get these shots, or even if we should get these shots? So They're most effective for short-term relief, particularly for acute pain and inflammation that's keeping you from doing something important. So if you've got a major event, you just need to get through it, one shot might be worth it. Or if you're in a rough patch, one shot might be worth it. But what's super important is that if you are getting these shots, you're doing something after. So whether that's strengthening the muscles around the area that's injured, because a lot of times from a physical therapy standpoint, I'll have individuals who are maybe just in a lot of pain and can't do as much exercise wise to build that strength. They'll go and get a shot and then they'll come back and see me and I'll tell them, okay, here's our window. This is where we have to be aggressive in terms of building some of that strength now that you're able to tolerate a little bit more. Um, but it's not a situation where, okay, I got the cortisone shot, I feel great, I can take my foot off the gas. You have to be aggressive and take advantage of those times that you do feel good, that you are able to strength train, so that when the cortisone shot does wear off, you're in a position where you're not worrying about the pain again. But if it's a situation where you're dealing with chronic pain, consider whether other treatments, again, physical therapy, exercise, anti-inflammatory medications might work better for the long term. And these approaches will help you address the root cause of what's going on rather than just covering it up. Because I think one of the problems is a lot of people see, okay, cortisone shot, quick fix, I'm on my way. That's not how they should be utilized. They should be utilized as one component in a bigger treatment plan geared towards getting you stronger and giving your joints more support. So, really, to sum it up, cortisone shots can be a powerful tool, but they're not a cure all. And they come with some risks. So, repeated injections can weaken your tissues, reduce bone health, and even impact your body's response to hormone production. That's why it's so important to work with your doctor to figure out what's right for you, considering both the short and long term effects that these shots can have on your body. So, always, always, always ask a lot of questions, get the right information, because there's nothing more powerful than having the right information at the right time so that you can make the best decisions for yourself and your health moving forward. Thanks so much for watching. If you found this video helpful, make sure and hit that like button and subscribe for more insights in managing your pain and staying active. Also, feel free to drop any comments in the question, drop any questions in the comment regarding questions you might have about cortisone injections. And then I'll also include just some free resources to help you navigate your knee pain as well. I'll include a knee guide as well as my phone number. If you have any questions, you can always text them to me. And I'm also happy to set up an online evaluation too, if you want to take a little bit closer look and see if this is something I might be able to help you with. Thanks again for watching and have a great rest of your day. We'll see you in the next one.